So let's talk about something you've probably experienced, or definitely will if you're ever admitted to a hospital in Canada. The doctor who's in charge of your care? Chances are it's not your family doctor. It's probably a hospitalist, one of the most important but least understood people in our entire healthcare system. And how they got there? Well, it's a story that's basically one big, fascinating accident.
So who are these people? Well, you can think of them as the quarterbacks of your hospital stay. They're the physicians who are running the show, coordinating everything from your tests to your treatments, all while you're an inpatient. And their job has never, ever been more important than it is right now.
So what exactly is a hospitalist? It's pretty simple, actually. They are doctors who specialize in the hospital itself. They don't have an outside clinic you can go visit, nope. Their entire world, their entire practice is inside the hospital's walls, managing your care from the moment you're admitted to the day you're discharged. And if we ever needed proof of how crucial they are, we got it during the COVID-19 pandemic. I mean, this quote really says it all. Hospital medicine teams were absolutely central to the frontline response. They were the ones caring for the vast majority of COVID patients who weren't in the ICU. They really proved their worth under the most intense pressure you can imagine.
But here's the wild part. This absolutely vital role, it was never part of some grand plan. It wasn't designed by a community. It was basically born out of a crisis, an accidental solution to a huge problem in Canadian healthcare.
So that's the big question, right? If they're this essential, where in the world did they come from? You'd think a role this important would have been carefully planned out for years. But the truth is, not even close. To get it, we've got to jump in the time machine and go back a few decades. Okay, so picture this. It's the 1990s, and we've got a perfect storm brewing. First, there's a shortage of family doctors, which creates a whole lot of what they called orphan patients, people who show up at the ER and have no family doctor to admit them. At the same time, the family doctors who are still working are just completely overwhelmed. The hospital care is getting more complex, the pay isn't great for that kind of work, and so many of them just started giving up their hospital privileges. This created a massive crisis. You had hospitals filling up with patients who had no one to manage their care. So out of sheer desperation, hospitals started hiring family doctors specifically for this job. And boom, just like that, the Canadian hospitalist was born. So, problem solved, right? Well, not exactly. See, this grassroots, on-the-fly solution created a brand new problem. Because it all happened so fast and so informally, there was no national plan, no standard for how to actually train these new specialists.
And when you compare Canada's situation to what happened in the United States, the difference is just stark. Down south, hospital medicine is a formal, robust specialty. It's mostly staffed by internists who have specific training, core competencies, even a certification option. But here in Canada, it was a grassroots movement, mostly staffed by family doctors, with no standardized training path to speak of. Two totally different ways of creating the same role.
And here's a really big piece of the puzzle. A standard residency to become a family doctor in Canada is 2 years, but in most other industrialized countries, it's 3 years or even more. That shorter training period is more focused on community care, which means residents might only get a couple of months of real experience on the complex inpatient wards.
Then in 2012, a commentary in the Canadian Medical Association Journal basically sounded the alarm. It laid out all the problems in black and white, hardly any specialized training opportunities, no defined competencies for what a Canadian hospitalist should know, no certification process, and very little data on the quality of care being provided. The specialty had basically grown up without any real foundation underneath it. Okay, so the alarm bells were definitely ringing loud and clear back in 2012. The big question is, now that more than a decade has passed, has anything actually changed? Well, the answer is kinda yes and no. It's a bit of a mixed bag. There has been some really important progress, for sure, but a lot of the fundamental challenges are still there. On the plus side, a huge step forward happened in 2015. The Canadian Society of Hospital Medicine finally put together a document defining the core competencies for hospitalists. This was a massive move. It was the first real attempt to standardize the knowledge and skills these doctors need to care for very sick, complex patients. And that has led to more universities offering extra training or fellowships in hospital medicine, which is great. But if you look closely at what's available, you start to see the problem. The programs are all different lengths, different types. We've gone from having almost no training options to having a patchwork system that still doesn't have a single, unified national standard. And this isn't just some academic debate, it has real consequences for the doctors on the ground. As this 2021 article points out, new family doctors who go into hospital work can face a really steep learning curve. A lot of them feel underprepared for the job, and that makes it really tough to recruit and keep people in these critical roles.
So why are we talking about this now? Why does this all matter so much? Because the pressure on our hospitals, well, it's about to get even more intense. The reality is, patients in hospitals today are often older and way more complex than they used to be. They frequently have multiple chronic illnesses all at once. Managing all that requires an incredible level of skill and coordination, and that job falls right on the shoulders of the hospitalist team.
And this quote from that original 2012 paper just nails it. The silver tsunami of aging baby boomers, that's not some distant threat anymore. It's here. It's happening right now. And this huge demographic shift is putting a strain on our hospitals like we've never seen before.
And just to give you a sense of the sheer scale we're dealing with here, there are over 42,000 family physicians in Canada. They are by far the biggest pool of generalist doctors, and they make up the majority of our hospitalist workforce. Making sure they have the right training and support isn't just a small issue, it's a massive systemic priority.
So, all of this leaves us with a pretty heavy question. We're counting on these accidental specialists to take care of us and our families when we are at our most vulnerable. But as our population gets older and sicker, is our current patchwork system of training really going to be enough to handle the challenge? That's something that all of us, as current or future patients, really need to be thinking about.